Dr. Pat with Little Critters, and we have two little ratties with us today. They're 2-year-old rats, so they are geriatric, and we're showing you these to show an important thing that we often see in older rats. This little one has a very large lump. If you look here, we have a lump that covers most of the side and covers a bunch of the belly and just kind of gets in her way when she's moving. It doesn't hurt her. You can touch it and she doesn't react, but what tends to happen with these lumps is they get so big, they get them stuck on things, they drag them and traumatize them. This is most likely a mammary fibroadenoma, which is a benign mammary gland or breast cancer tumor of rats. And it's important to note that they can get these tumors anywhere from their neck to their tail, all along this whole area and on the sides. They have extensive mammary tumor. You can see these in just about any location. And this is a sister, also a 2-year-old rattie, and we're using her as an example of a less obvious tumor. You can see you don't see anything on her sides, but if we look at her belly, kind of the groin region, we have a lump right here. That's actually a common site. The groin area is a common site for many of these masses, often right by the vulva. But again, they have tissue all the way down, both sides and the midline. And this breast tumor can occur in any of those areas. We want to prevent this to have spayed them when they were young. So if you're thinking of getting rats and you're going to get a female rat, then you should factor in spaying them as babies. Typically, we'll spay them at about 12 weeks old. You want to spay them before they start having multiple heat cycles, which releases estrogen into the mammary tissue. And later in life, that estrogen is built up and stimulates mammary tumors. We actually do midline ovariectomies, which means we make a tiny incision on each side, and it's literally the width of my fingernail, and take out just the ovaries. The benefit of that is we don't have this ventral midline incision, so there's not a big incision to be traumatized by them, because rats like to use their little handsies and pull out sutures. We just have a tiny incision on the side. It doesn't seem to have as much abdominal pressure on it. It doesn't seem to bother them. We do send them home on pain meds and then put sutures under the skin, and they do really well with that. It's a very short procedure. It is under general anesthesia, but it's very quick. They recover well, and it prevents the estrogen that causes the problem. So we need to do that when they're young, when they're babies. At this point, it wouldn't make a difference. If we do see tumors in these rats, the next step really is surgical removal. And I usually recommend removing these tumors when they're small, so we don't have really big surgeries that would require an incision going down the whole side of the rat. The downside of surgical removal is mostly that they can and often do get more tumors in other locations, because this is, again, stored estrogen in tissue. So while it cures the tumor we took off, it doesn't prevent new ones from coming. But it is a quality of life issue for a lot of these ratties, where the tumors do get so big so quickly that we end up having to take them off to prevent just mobility issues and traumatizing skin wounds. And they do really well with surgery. It's just important that they have the pain meds and the aftercare. That's mammary fibroadenomas in rats.